I'm delighted to be able to present our work from NHS Tayside to you again. I recognise some familiar faces from when you've heard of our previous project, and now we have a new ambitious project that we're absolutely delighted that the Scottish Government have decided to fund in the next round of international development funding. Instead of words, I'm going to show you some pictures because they speak 1,000 words. Queen Elizabeth Central Hospital in Blantyre is the only teaching hospital in Malawi originally, and that was the site of our original Scottish Government International Development funded project to develop the first dedicated adult emergency and trauma centre in Malawi. On that site there was pre-existing to ours was a paediatric emergency department that Professor Liz Molyneux, who was the Professor of Child Health there, had developed along with her team, and it had a drastic reduction and improvement on health for children. We were invited by colleagues in Malawi who were working and knew of our interest in emergency care to see if we could help with this. This now is a historical picture of Queen's, because this was the admin building, which is now the Adult Emergency and Trauma Centre. We have a team within NHS Tayside, Charge Nurse Gwen Gordon, who's our project lead nurse. It's very much a multidisciplinary approach. One of my consultant colleagues, Russell Duncan, whose father was an obstetrician and gynecologist and has been involved with Heather and others with other projects, and Linda Imrie, one of our other charge nurses. We're the strategy team. But most importantly in Malawi, you need your partners. You need to have good people-to-people care, and we had that in an outstanding matron and lead clinician who helped us support that. This was the Accident Emergency Department, or as they called it, OPD, Outpatient Department. 1,500 to 3,000 people a day, that's 10 times the volume of any of Scotland's busiest emergency departments, would come through here. There'd be no prioritisation, no treatment, and people died in the waiting room. That was the reality. We had some very clear and simple objectives: to reduce the mortality, to improve the standard of care, emergency care, to develop a fit-for-purpose training programme for all staff, to encourage the beginning of collaborative research, and then to leave them at the end of that first pilot project with a sustainable emergency service that, if anyone walks into it today, would recognise it, from emergency medicine in the world, would recognise it as an emergency service. We were grateful to the Wellcome Trust, the Malawi Liverpool Wellcome Trust, some other local donors, including some local Malawian bankers, who helped fund the development of the infrastructure and the building of that, and that we were extremely grateful for that. And in 2011, this became the new emergency department. And it's gone from that to that, and you can see in amongst the patients and the Malawian staff are the Scottish staff, because it's a true mentoring relationship that we have. Many projects have gone and taught didactically and taught in classrooms and developed skills and allowed staff in Malawi to go on and develop those skills. But we had so few staff that we couldn't remove them from the shop floor. We had to get on the shop floor and work with them. And we developed this true mentoring process, developing and supporting, and we learned as much as our Malawian colleagues learned. It's a true two-way flow. Developing earlier treatments for patients. They were prioritised for the first time. They developed earlier treatments, and this true mentoring existed between the nurses, the clinicians, and the medical staff. We had obvious opportunities to teach. The mornings were busy, the end of the day not so. So in the afternoons we did some part of our teaching and training programme, but the wealth of clinical material coming across the front door of that department meant that we were teaching all the time on the development, and here training some of the young Malawian registrars in emergency care to develop their skills. There was classroom teaching, and we developed a trainer so that was sustainable. And the impact, well, there were improved treatments, earlier treatments, less emergency admissions due to the emergency department short stay ward that actually could turn asthmatics, simple things around non-complicated malaria, simple asthma attached with some nebulizations, and they can go home the same day from that unit with inhalers and with medication. And there was definite improvement in the death rate on admission for adult patients at Queen Elizabeth. The Scottish Government International Development Team came, visited us. The former International Development Minister, Hamza Yousaf, who's now our Justice Minister, visited the unit and was overwhelmed with what he saw had been done. It is basics done better. I mean, that's what we're all about. It's not high-tech stuff, but it's about getting the systems and processes right. But Malawi's a big country, and the Queen's is not the only central hospital in Malawi. So the Malawian government, to the end of our project, were keen that we look to the other big central hospitals, Kamuzu Central in Lilongwe that we've heard about already today, Mazuzu and Zomba, to try and get an emergency and trauma network in place. We visited Lilongwe and met with the hospital director, met with the Ministry of Health. And this year, at the end of August, we got the news that we've been funded till 2003 to develop those 3 emergency departments across country. Kamuzu has possibly a little bit better infrastructure than we found at Queen's to begin with, but still not really fit for purpose, so there needs some work going on there. But this is the current situation, so we need to get those systems and processes in here, and then Mazuzu, and then Zomba. And our project is, with Scottish Government funding, to put an emergency and trauma centre at the front door of each of those central hospitals. And at the end of 2023, Scotland, with its four major trauma centre network, will have a match with Malawi with its 4 major trauma centre network. And that's our aim. Our aim will to have an emergency department. This is the schematic map of Queen's now that you see stuck on the walls to help everybody negotiate the vast complex that it is. And the red area in the middle is the emergency department, and each of those need one. Because after all, emergency care, when you can't get it anywhere else, is a human right, not a privilege. Thank you.